Welcome to today's update. In this video we're going to be looking at the Americas. We're going to start off with Bolivia and Brazil, a couple of South American countries. Then we'll look at the United States and Canada. Now, just before we start, the Bolivian section is not going to be easy to listen to. It shows what can happen when the demand for healthcare services in a country outstrip the ability of that country to supply the healthcare demands of its citizens. And as we'll see, this is having dire consequences. So Bolivia, a relatively small South American population country, 11.5 million people. These are the official number of cases and deaths, but we'll see why these are underestimates in a minute. Now, Bolivia's got 30 official languages, which just shows how important it is to communicate, because it's been difficult to communicate the health education messages in Bolivia because of the 30 different languages and indeed the associated cultures with that. There's a lot of indigenous groupings live there still. So it just shows how important it is to be able to communicate with the people in a country, because the communication in Bolivia has not been effective for this reason. They don't seem to have worked around it, but it's just that there's a good example there for everyone. Even if a country is completely monolingual, it still shows the importance of good communication with the people in the country. There's also a widespread belief in traditional medicine. And likewise, everywhere in the world we've got fake news problems and people talking rubbish, people making claims for which they have no references. So belief in traditional medicine, which is not evidence-based, is also a problem. Now, this doesn't mean to say there's not good things about traditional medicine. Of course there are. You know, for some things it can be very efficacious, but there's no antiviral traditional medicines. Otherwise, I think the pharmaceutical companies would have jumped on it by now, big time. Now, healthcare spending in Bolivia is $450 a year per person, so well below even other poorer countries round about, such as Chile or Cuba, for example. And there's massive community spread now of COVID-19 in the cities. Now, this report comes from DW News. Now, it's Deutsche Welle News. So it's surprising how few news outlets have mentioned this. I've never seen Bolivia and the disaster that's unfolding there mentioned on the BBC, for example, in my country, but that's not the best news outlet in the world anyway. But it's just interesting that we basically seem to be ignoring it, which is why I wanted to bring it up today. And I really hope you can share this information around, because really there's so many people in need of help through lack of basic facilities here. Patients have died after being turned away from medical centres. Now, do watch this video if you can. It's distressing to watch. It took me half an hour to recover from it before I could really process the information, but do watch it. Patients died after being turned away from medical centres. Hospitals full in most cities. Funeral parlours are out of coffins. Family members not allowed to enter cemeteries. So you don't need me to spell out the distress associated with that. If you're looking for a hospital place for a family member and you're being turned away, that is a very distressing situation. And if you are the person who is fighting for every breath and being turned away from a hospital where they're supposed to look after you, it's hard to think of anything worse, actually. Now, police are picking up 70 bodies a day from the streets. 85% of those bodies are infected with COVID-19, meaning that 15% of people are dying from other things because healthcare is not available. And again, the video evidence for this is on that Deutsche Welle news clip, the only one I've seen, as I've already stressed. Now, the worst hit areas, Santa Cruz, La Paz and Cochabamba, the cities. So people have been driving around in cars and on public transport looking for medical aid. Now, this is remarkably bad because it means you've got people that are definitely sick going on public transport trying to get to a hospital. Situation of guaranteed spread, of course. People dying at home because they're unable to access medical care, turned away from a chain of hospitals. People have been turned away from 4 or 5 hospitals. They can't get in. You can pay to get into a hospital if you pay quite a lot of money, but of course most people can't. So we see that there is financial corruption involved in who lives and who dies. The police are issuing death certificates because there's no other way people can get permission for burials. And there's a total collapse of healthcare testing and recording. So this is why we know things are accurate, because there's a complete collapse of medical organisation in Bolivia. So that means that not only has the healthcare system collapsed, but the testing system has collapsed and the recording system has collapsed. So we will probably never know how many people are dying today in Bolivia. But we know that many people are dying on the streets because they're being turned away from hospitals. Now, what does this mean? What it means is people are dying from simple things that we could so easily treat. So we know 4 or 5% of people get critical illness, and we know that the mortality in the UK has been, we could argue about it, but let's say 0.5 to 1%. So it kind of makes sense that healthcare is saving the lives of 4% of those that are affected by the virus. And if they're not getting that, then we would expect the case fatality rate to go up, or the infection fatality rate to go up from 0.5 to about 5%. So the death rate in Bolivia could be up to 10 times higher than it would need to be if the healthcare infrastructure was available. And very often it's basic healthcare things that are needed. Let me give some examples. People are dying from simple hypoxia, which we treat with giving oxygen. So we can easily treat that. I mean, the classic example is our Prime Minister needed oxygen for 3 or 4 days, and then he recovered. Without that, Boris Johnson would probably have died. Very probably have died without that oxygen. Simple thing, giving oxygen. People are dying from the direct effects of the virus. People are dying from sepsis. They're dying from shock and circulatory failure. Shock is the low blood pressure that means the circulatory system fails. They're dying from inflammatory systems that we can easily treat with, or we can treat with dexamethasone, which we know is efficacious. People are also going to be dying from secondary bacterial infections. Now, perhaps in vulnerable groups, we don't really know the numbers for sure, but 50% or even a majority of people that get COVID-19 will get some secondary bacterial infection if they're particularly ill. And of course, we can easily treat those. But without the appropriate antibiotics, often intravenous antibiotics, it's not a high-tech thing. We'll give them all the time in accident and emergency departments. Relatively straightforward. You put a cannula in, you mix up the antibiotics and you give it. There's a few things to look out for, of course, but it's not a complicated procedure. I've done it many thousands of times, I suppose. Or even oral antibiotics might be enough to save lives in many cases as well. So people will be dying of that if they can't access healthcare. Dehydration and renal failure. Dehydration we can treat with simple intravenous fluids, and that would hopefully prevent renal failure. So people will be dying of these simple treatable conditions, complications, which we would normally save these people's lives with what we call simple supportive treatment. In La Paz, police collected 140 bodies from the streets in 5 days in La Paz alone. And the opposition groupings have been, I don't know if they've quite been advocating chlorine dioxide, but chlorine dioxide is being apparently sold, which of course is simply terrifying. It would be sold as presumably a tablet or a solution. And yeah. I mean, it's true that chlorine dioxide in drinking water will kill bacteria, viruses and some parasites, but we don't advise that people ingest any form of antiseptic like that. This is just horrendous. If people are so desperate as to take things that can kill them, it's a pretty frightening situation. Again, showing the great lack of communication in the country and the massive ignorance that would facilitate such suicidal activity. Brazil, likewise, cases are greatly increasing, deaths are increasing. Check on the situation. There's many news articles about Brazil. That's just one from the UK. So Brazil going in a similar direction. Now, this indigenous chief has died sadly. Our thoughts and condolences go to his friends and family. He was the leader of indigenous groupings in Brazil. And half of Brazil's 300 indigenous tribes have confirmed infections. And of course, in Bolivia also, there's a lot of indigenous peoples affected. And we looked at this in the United States, where indigenous groupings do seem to be disproportionately affected. And it seems to be the same situation in Brazil. And we know that many of the deaths in indigenous areas are simply not reported. We've seen video evidence from that several times. So many indigenous areas affected. Probably half of the indigenous tribes have confirmed infections. And this is an indigenous national park in Brazil where there's 22,000 cases, 631 deaths. But again, this data is hard to collect. Now, these figures are way higher than the official government figures, but these are locally collected figures. So they're going to be more accurate. And the worst is yet to come in these areas. Now, moving on to the United States. These numbers, of course, just keep going up. Virginia, COVID-wise tracker app, Bluetooth signals, keeps it anonymous, pings for close encounters, contacts then notified without revealing identity. So your Bluetooth on your mobile phone has got a record of who you've been in close enough contact with to spread the virus. Should you be tested positive, those people will then be informed, and those people can then self-isolate and arrange rapid testing. Makes perfect sense. Ralph Northern, the governor of Virginia: no one is tracking you, none of your personal information is saved. Virginia, of course, is well ahead of the United Kingdom. We still do not have such an app. Now, this Virginia app is running on software from Google and Apple. So it's much more likely to work than the one that the British government tried to put together and failed to instigate after the trials in the Isle of Wight all those months ago now. And we still don't have one. Unbelievable, really. We've got this simple method that can save thousands of working hours for contact tracers. Tens of thousands of man and woman hours can be saved, and it can do the job more efficiently just by having this app on the phone. But the UK government hasn't managed to do it yet, and Florida is the only state that's instigated it so far in all of the United States. The other 49 states need to get their act together. I believe 3 other states are about to institute it, but they're not there yet. So given the technologically advanced natures of our countries, dear me. Right, Florida. Testing's resumed after the storm. High positivity rate, meaning there's a lot of community virus around, meaning there's a lot of community transmission. Over 500,000 cases now in Florida. There was 225 deaths in a 24-hour period. But the good news is hospitalisations are down for the past 2 weeks, down 175 in the last 24 hours. Now 7,622 people in hospital. Now, there's a lot of debate about the data in the United States, and we have looked at that with the change in the methods of reporting data. Now much more centralised rather than going via CDC. A lot of people are emailing me to say the reason the numbers are down is because testing is being deliberately reduced or inadvertently reduced. But nevertheless, the fact that hospitalisations are down is a pretty positive indicator. And this was interesting. Marlins Park in Florida, 15-minute test results. Now, if we can get test results back in 15 minutes, that's brilliant. Now, we noticed in a Lancet, I assume these are saliva tests. I don't really know how that's done. I'm going to have to find that out. But we know from the article from the Lancet, a few weeks, well, probably last month now, that if tests take more than 3 days, probably you might as well not bother because you've already infected people after that time. And we know that tests have been taking 7 days. So 15-minute tests is a game changer. It really is. The positive person will know immediately to self-isolate, warn their contacts. If they've got the mobile phone pinger as well, then automatically all their contacts will get a text message In Florida, they don't have that, so it's got to be done manually. But that 15-minute test, if that is panning out, is a remarkably positive advance. And in combination with a mobile phone app, that could be a complete game changer. But even on its own, a 15-minute test, as long as people comply and self-isolate, is remarkably helpful. That can make a big, big difference. So pleased to see that. Georgia, 13% positivity rate. We've seen these pictures of school pupils, or do you call them students in America? I don't know. In the UK, if you go to a school, you're a pupil. If you go to a university, you're a student. Anyway, these young people packed in hallways. And one class, someone tested positive and they were quarantined for 2 weeks. Now, this is bemusing. The authorities in the state of Georgia, I'm sure, are aware that 13% of the tests are coming back positive. Therefore, they know there's a lot of community presence of the virus. Therefore, they know a good proportion of the population will be affected and there's community transmission going on. And yet they can't organise return to school to stop these pictures of young people being packed, literally packed, into hallways. That is a great failure of logistics, whoever's organising the schools in Georgia. Or so it would appear to me. Pupils packed in hallways. This should not have happened. Chicago, a 5% positivity rate, and as a result of that, schools are going to only open in line. So interesting contrast there between the approach taken by Georgia, opening schools and then not organising the return as I would like to see it organised, or anyone would like to see it organised, with a 13% positivity rate, whereas Chicago recognises the importance of 5% positivity rate of testing, recognises that means there's a lot of community virus around and schools are going online accordingly. So we see a great difference in approach there between Georgia and Chicago. And in my view, the one in Chicago is much more likely to limit transmission, obviously. Right, New York, 1% positivity rate. Check stations now going into New York. Travellers from 34 states must self-isolate for 14 days. So people are being checked in some places as they go in to make sure this is complied with. New York, 1% positivity rate. Very, very encouraging from the epicentre that New York was. Now, Dr. Fauci, latest on the vaccines, tens of millions of doses early part of next year, 1 billion by the end of 2021. The reason it can happen so quickly is the manufacturing is being put in place before we know for sure that the vaccines work. But Dr. Fauci does seem to be confident they are going to work. And several vaccines, of course, have been, in England would say you put dabs on it. I don't know what you'd say in the States. Several vaccines have been pre-purchased by the United States government. Put their eggs in more than one basket, so that's encouraging. Now, finally, on the Americas update, let's just look at Canada. Before we do that, let's just look at a graphic here. Yeah. So this graphic is cases. Now this is new confirmed COVID-19 cases per capita. This is adjusted per million people because obviously the United States has got a much higher population, but this is accounting for that. This is a linear scale of new confirmed cases. Now, as we've looked at, in Bolivia, cases are going up. But this is a mass underrepresentation of the actual data in Bolivia because, as we noticed, the testing system has broken down. Brazil officially levelled off. The United States officially going down in number of new cases. Still a lot of new cases per day, of course. But where's Canada? Where is it? This is a linear scale. Wow. That's the difference. So Canada looking like it's done a pretty good job. And this is fascinating, of course. As always, you have the link starting there. Nunavut, isn't that brilliant? The indigenous areas in Nunavut protected. Northwest Territories. What's that? That's Yukon there, isn't it? Sorry, Yukon, 14 cases. Northwest Territories, 5 cases. British Columbia, relatively low number of cases. Alberta, Saskatchewan, Manitoba, Ontario. Most cases, of course, are in Quebec area. But even although New Brunswick is just next door, it's impressive that they managed to contain that in New Brunswick. Likewise in Newfoundland. So, yeah. Basically, do look on this site. Lots of fascinating lifetime data. Do check it out. But I mean, I think basically this graphic here says quite a lot, doesn't it? These American countries, this American country. Let's hope it's sustainable. A few figures from Canada there. So the positives are just 111,000 for the whole country. And this was the site here where that information I've just looked at came from. So do check on that. So quick conclusion about the Americas. It looks like the United States has managed to level things off, but it's got a long way to go. I mean, this reduction in new cases, it still means they've got an awful lot of new cases per day. So as we see here, it's still, even if it's there, it's still it's 170 new cases per day per million people. So it's a lot of new cases still cropping up. So although the downward trend is good, of course, it's still got a long way to go. There's still a lot of community transmission throughout the United States. And some of the poorer countries in the South Americas, people are dying unnecessarily. And we had predicted this back in January, actually, February, we predicted this, that the number of cases could grow in some areas more rapidly than the health service could cope with, and people would die unnecessarily as a result. Thank you for watching, as always.